Dr. Shekhar is a former director of Karnataka Institute of Endocrinology and Research, Bengaluru, former professor of medicine, and head of the Department of Endocrinology, Mysuru, and director consultant diabetologist, Apurva Diabetes Foundation. He's been member governing council, Mysore Medical College, member of governing council for JSS Medical College, visiting faculty and areas of interest, epidemiology. So many feathers in his cap, and so I would straight away request him to please start his talk on yo-yo dieting, how to manage yo-yo dieters. Over to you, Dr. Shekhar.
At the outset, I am very thankful to the IDEC team for this opportunity to, share my feelings and understanding of this question for the day. But I'm sure the evidence medicine rather EBM pundits will be a tad bit disappointed with me because I do not have very strong evidence for this. And I'm sure the followers of pseudoscience on social media will be very angry with me. Please bear with me. No conflicts of interest from my side. We'll start here. You all know this picture, right? Once upon a time it happened. I cannot tell you the whole story. This is the story of Wright brothers, who did the first flight the world ever saw. But what happened to them in future or whatever in the next few days or things like that, we do not know much. But this tells us what happened to these Wright brothers when they did it wrong. So I will be talking about the right and wrong of what is yo-yo diet today. As I was telling you, indeed, it's a jolly ride of scientific evidence, not very strong, and real-world eminence, bicycle about the weight loss story, that is the yo-yo dieters or yo-yo dieting. So many things are there. Fad diets, let me upfront give you two concepts here. Fad diets, most plans that promise weight loss within the first week, 2 weeks, I'll assure them it is going to fail. Because even if there is weight loss, the diet itself is difficult to sustain. And my predecessors have fantastically spoken, and you know how Anjana was so emotional about what she wanted to present. And a better way to lose weight is to eat with your health in mind. So fat diets on one end and then healthy eating on the other end would be the balance that we are looking at. How do we do that is the question that we'll see. Vicious diet cycle. You all know diet you start because you're worried, body shaming, so many funny things, psychological, health issues, etc. Start dieting, you decrease your calories, famine response, you lose weight and metabolic rate comes down. The whole story happens like this. It goes back. Once complacency kicks in, oh, I have lost weight, I'm doing well, I have to improve my taste buds, the repeat cycle occurs. Diet cycle is a vicious cycle. This is what we have to understand really. Now, the question asked would be, is it a villain or a scapegoat? As on 2021, August or September, we need to look at dieting, whether it is the villain of the century or it's a scapegoat of all possible scientific discourses and pseudoscience that has been thrown around in the social media. And research has generated so much of controversies over the years, at least for the last 2 decades. And this controversy has spilled over into the public domain. You know, the social media, especially as eating disorders and obesity. And we do not talk much about the so-called obesity, regaining your weight and becoming obese, a little bit more obese than what you were earlier. And eating disorders because there is the conflict between your psyche and the soul. So the pressing problem, if you ask me, is not dieting itself, but the collision of modern food environment, beautifully brought by my predecessor speakers, with our immutable evolutionary heritage. You know, the thrifty gene, thrifty phenotypes, all those immutable evolutionary heritage that we have carried for thousands of years. that drive us to find and consume food when it is available. So today, 30, 40 years later, when food is so much available and at such less price, we are driven to eat. Dieting is more a scapegoat, if you ask me, than a villain because of these two components. And today, instead of saying going on a diet, it's more fashionable to say I'm eating healthy, even though they are not doing a healthy activity at all. But it's in our nature, human nature, that we need to find questions and find answer to these questions. It's not just finding answer to the questions that are in front of us. It is also to find questions. Researchers, for example, they find questions and they want to try to get answers for that. So it's in our nature. And you know the story, Maha Mantra of weight loss is decrease calories intake. Everybody has spoken. But this is very important. Food intake is a very important component of weight regain after weight loss. Simple concept. You have lost weight. How do you regain your weight that is lost? Food intake. Simple equation. 1 is equal to 1 is equal to 1, things like that. But unfortunately, in the modern societies, a chronically positive energy balance is the norm for many. Chronically, somebody was talking after the physical seminars and whatever, what do we do? You know the story, either lunch or dinner. And calorie restriction, how long has remained a point of contention? You've already said 6 weeks, 8 weeks, 6 months, 1 year, 2 years, intensive phase, maintenance phase. It has remained a point of contention in the realm of science. And as a result, so many diet regimes, food fads have become fashion of the day. I'm sorry to make a statement like this, don't mistake me. And one such is yo-yo dieting. Let's come to the yo-yo dieting component. You all know this yo-yo. I was fascinated 45, 50 years ago when I saw the first yo-yo. My uncle brought it from Singapore. I didn't know how to use it. Now everybody knows about it. And this is it, yo-yo. You know the story. Most of you have used it. At least the younger generation have known about it. But the issue is yo-yo effect, yo-yo dieting was coined by Kelly D. Brownell, who is, of course, he's still there, psychologist and a public health scholar, not a fantastic researcher into diets and weight loss and metabolism, etc. like that. It came from him. Obviously, because it's the word yo-yo, he is obviously an American. Describes the pattern of losing weight, cyclical loss and regain of weight. Yo-yo, you lose, you gain. You lose, you gain. It goes on. And when it is done by diet, it is called yo-yo dieting. Otherwise, many features are there. It is called weight cycling. The generic term is weight cycling. You keep cycling your weight. Clean dress, put them, dirty dress. Clean dress, the story goes on. And who does this yo-yo diet are yo-yo dieters. Simple. Why not call it seesaw dieting? This is what I was talking about, because yo-yo dieting is about losing good amount of weight, regaining good amount of weight. 20 kgs, 15 kgs, and regain the 20, 25 kgs. And seesaw, if you have seen seesaw, you cannot go so high, you cannot go so low. So seesaw dieting also, I would request some of Dr. Anjali, Dr. Anjana to look at it and bring a concept of seesaw dieting in India. Why follow Americans? In simple terms, yo-yo dieting is this: the diet, the plateau, the fall off, and the relapse. It goes on, the cycle goes on. Diet, when they become very conscious of their weight, extreme crash diet, weight loss, metabolism slows down, they hit a plateau. Then, unable to lose anything more, they lose interest in that, they start eating, relapses. It's a very tasteless, very colorful, but very tasteless concept of yo-yo dieting. But when you put you into yo-yo, it becomes you. So it is you which is very important, the central figure in this cycle, the vicious cycle of diet or yo-yo dieting, simple concept. And bad effects of yo-yo dieting: muscle loss, weakness, demotivation. I have highlighted it. And there is a huge list. And when you Google it or when you have your scientific components with you, there are so much. But everybody has spoken about weight loss is not just about fat loss. It's also significant amount of muscle, bone, etc., etc. That is the very bad effect. And the whole thing, we'll talk about it a little bit later. But that brings to the concept of skinny fat person. A dieter who has been going on diet becomes a yo-yo dieter, becomes a skinny fat person. Their arms and legs are skinny or thinner, and they have their central portion in a bigger manner. This is the biggest problem that we are facing with so-called dieting and diet fats that has happened. And you know the story, muscle and fat lost, only fat mainly comes back. Muscle doesn't come back unless, as Dr. Nambiar was talking about, strength exercises, etc. Muscle is not brought. Things happen. It's in a nutshell about bad effects, which is much more important than to look at why yo-yo dieting is done, etc. like that. But that brings me to the concept of it is better than nothing. Not doing anything. Yo-yo dieting is better. Do you think we should accept it? Is an important question that we have to answer ourselves. And the strategy has negative connotations. What is that? Several controversial reports on the effect. True. I don't like you. I want to disprove you. It happens. Some weight cycling is linked to a net increase in weight gain and body fat, and some other scientific discourse says no adverse metabolic effects is seen. But mind you, it is not very strong. The scientific evidence is not strong either for weight gain or so-called abnormal metabolic effects. But the focus has been on short-term outcomes. All their focus is on short-term outcomes, not next 2 years, 5 years, 10 years of the person's life. Let's not call them as patients. Okay? So this is where we have to rechange our activities, and majority of the so-called concepts of these dieting, etc., have come from animal studies, and it is inconsistent. You all know the story. That brings me to certain thoughts which I have added on in the last 2 days about, are there non-medical concepts which can be put into our thinking process in the medical science and look at it. And 2 or 3 I have come across. The first one is summer matter cycle. Summer matter is nothing to do with summer and matter. It's a person. He was a Swiss nutritional physiologist. It's the physiological concept describing the complex relationship between physical activity and inactivity, complex relation, plus energy expenditure and conservation, eating, not eating, etc. like that. The concept explains why dieting fails in most cases that results in yo-yo effect, which he called it as preferential catch-up fat. They lose weight, muscle, fat, and some amount of bone and the rest, and they catch up with fat activity because of energy conservation. We'll come to it. What is this energy conservation? The second one is the restraint theory, which has been the earliest and the longest lasting theory in the framework of eating, the restrained eating framework, chronic dieting, and restrained eating. You eat less. Everybody keeps telling you, eat less carbohydrates, more fiber. You know the story. But this restraint theory is the most controversial one in our thing that has happened in the field of psychology because of emotional over-involvement with food. It's only this animal in the animal kingdom, none other animals, which eats white rice, red rice, green rice, that rice, etc., etc. That over-involvement. Ask a dog, it eats just what it's given. The last one is risk compensation or Peltzman effect. I'm sure many of you have come across this word, Peltzman, Sam Peltzman. He was an economist in the 70s, probably 74, 75. He wrote a paper on effects of safety belts in accidents and deaths. And he, it was shocking to the world at the time, 30, 40 years ago, stating that safety belts have paradoxically increased morbidity and mortality because of highway accidents. Why? That's called as risk compensation. People typically adjust their behavior in response to perceived level of risk. There is a higher risk, you adjust. Classic in COVID-19 times. When the risk comes down, everybody goes out and has gala time. When the risk increases, there are more number of COVID deaths and more admissions, they become careful. This is called risk compensation. It's already there. It's also used in economics. certain features of yo-yo dieting. My feeling, there are so many certain features. Most individuals fail to maintain weight loss. Weight regain starts within first year. They are all been talking about first and second year. All my predecessors have been there. The weight regain starts with any of these diets, especially so in yo-yo dieting, within the first year. And pre-intervention, intervention or whatever you want to call it, weight regain will be occurred within 2 to 5 years, or they surpass it. The limiting or preferential avoiding of weight cycling in the first year of weight loss appears to be the crucial important component. So, if you are confronted with how to help these people within first year and the next following second year, if we can take care of weight regain, we can do a great job for these people. A successful weight loss maintainer is defined as who voluntarily decreases more or equal to 10% of initial body weight and keep the lost weight for at least 1 year and above, is what is called as a successful weight loss maintainer. It's a definition for you. But why it does not occur is science that we have to discuss. The compensatory response to weight loss. What happens? What is the physiology? What is the neurophysiology, neurohumoral physiology behind this? I will not delve in deep. Profound deregulation of nutrients. When they crash their diet, there will be altered secretion of orexogenic and anti-orexogenic or anorexogenic hormones, disbalance, hypothalamic and other cerebral circuits lead to endocrine adaptations believed to drive hyperphagia. They cannot stop eating. That is the funny concept, not just in humans, also in animal experiments, more so nicely spoken in animal experiments. Altered level of circulating hormones that facilitated weight regain appears to persist for at least 1 year. Now, can you put them together? 1 year weight loss, within 1 year they regain. Why? There is this physiological response or abnormal physiological response, I cannot say pathological, of your so-called orexogenic and anorexogenic hormones in the body of the so-called yo-yo dieters, etc. 1 year it happens. What's the outcome? Weight cycling makes subsequent weight loss more difficult to regain, and it's more rapid. This is what we have to talk to our so-called our patients who are ready to do this. If you keep cycling your weight up and down, the future will be more difficult to lose weight and you start gaining weight rapidly. This is fantastic. And increased risk for all-cause CV mortalities, psychophysiology, and life dissatisfaction, binge eating. This is the concept. What's very important, let's put aside the psychology component there, but all-cause and CV mortality, increased risk, it has been shown. This is the unfortunate thing of yo-yo dieting or weight cycling. And this slide, I'm not going to talk in detail. Weight cycling, fluctuations in blood pressure, heart rate, fluctuation in GFR, weight gain, fluctuations in glucose and lipids, increased cardiac load, glomerular damage, etc., etc. Eventually, cardio-metabolic outcome worse for the patient. And last, yo-yo diet. It works for many of them who have lost weight and forgotten that they have regained some amount of weight. They think it works, but does it really work? The naysayers are also there in science. No adverse effects of weight cycling on body composition, resting metabolic rate, body fat distribution. I'm just giving naysayers. Please do your research component of this. And evidence for an adverse effect of weight cycling appears sparse, if exists at all. The only reason is the amount of scientific discourse and research available is at best sparse. So some tips how to go about it, how to help yo-yo dieters. Unfortunately, the most important person who can help the yo-yo dieter is the yo-yo dieter himself. This has to be driven home in a very strong manner. Aim for realistic weight. Physical activity will help to keep maintenance component, decrease the amount of calories. Don't eat when bored or nothing else. All these things go. But what's important is please have a good nutritionist help, not the best. Go through the Google, oh, this is the best nutritionist. Let me go to them. They are very busy and it will not help. This is my tips that I'm going to give. This is one thing I'm sure Neeta may not like it. Precision nutrition, I just picked it up in the last minute. Yo-yo dieting, which we are talking, it's not good for it. And reverse dieting, which has already been there in our so-called practice, especially so in the bodybuilders and athletes. You know, they want to lose weight, significant calorie restriction, they lose weight, and slowly they start increasing their calories, called as reverse dieting. Let's see. So people who really want to lose weight and the psychosomatic and psychosocial components make them yo-yo dieters, you can try reverse dieting. I'm just trying to tell you, you can try. Dr. Neeta and others may not agree. They may pounce on me on this. To summarize, weight loss is extremely challenging since eating patterns are difficult to change. We all have to agree. Weight loss is associated with adaptive physiological process already mentioned that leads to starvation response and hyperphagia eating. Negative energy balance stemming from severe calorie restriction, strong counter-regulatory stimuli kick in. We have to be very careful with this. Make widespread changes to food environment. You know, one of the chairperson was saying it is so difficult to make a person change, but the environment to change is much more difficult. Refocus the concern on true source of obsessions with eating, weight and dieting. A food environment that is unhealthy as tobacco environment. You all remember 50s, it was very popular to smoke. You all know the story. And switching from an obesogenic to a healthier diet is necessary to lose weight. And the catch thing is, what is obesogenic versus healthy diet? I leave it to you for successful and sustainable weight loss. Conclude, yo-yo dieting is a consequence of interplay amongst various factors I've just mentioned. Over time, small changes make a big difference, resulting in sustainable weight loss. So one step at a time, baby steps at a time makes a better sense. And paradigm of fast versus slow weight loss still lacks solid experimental proof. I should accept this. Self-discipline remains vital. The rest, you all know the story. Thank you for this. Anything is possible when you have the right people there to support you. And I'm sure we should be the right people for the patients. Thank you.
Thank you. Thank you, Dr. Shekhar, for that enlightening talk. Before I ask the question, I hand over to my co-chairperson, Dr. Arvinda.
Talk, Dr. Shekhar sir. We always knew about yo-yo toy and yo-yo anything also. So, but this one was a different topic. Like, sir, wanted to ask, like in a clinical practice, do you suggest yo-yo dieting to any of your patients?
I have never suggested yo-yo diet.
So because we know now so much of various types of dieting are there in the market. So people are getting confused by the social media and the various network they have got. So every day and night, every day, I'm sure people will come and ask you, sir, I'm doing this diet. I saw this diet. I'm doing this. And I always tell them, you do a simple diabetic diet. There is nothing like diabetic diet. Simple individualized diet, which my dietitian tells you, just follow that. Don't do extremes of dieting, because ultimately after 6 months or 1 year you're going to stop and it will rebound. You will find a more gain of weight and all those things. That is what your talk, the presentation was like that, sir. So any opinion on this, sir?
Yeah, may I make a comment on this?
Yes, madam. Yes, madam.
Yes.
Yeah. I feel that yo-yo dieting is not a diet in itself. It's more a consequence of failed attempts at diet, and weight regain happens because of a variety of factors. So now that we recognize obesity as a chronic disease because of the hormonal imbalances that happen after weight loss has happened and the maintenance period is difficult, I think there could be a role for pharmacotherapy after weight loss has happened, in order to balance out the hormones, like for example the GLP-1, all the hunger hormones which start to go up and the satiety hormones which start to go in the wrong direction. So pharmacotherapy may be the answer once weight has been lost, and that would be the one to prevent yo-yo dieting. because weight maintenance may be better with pharmacotherapy because we know it is a disease.
Issue is, way back 2005, I remember I had given a talk on hypothalamo-enteroinsular axis. I urge and I request all of you to, do your homework. When we look at that, it is not pharmacotherapy that's going to really save the day for obese people or the so-called disease component or low-grade inflammation, whatever you want to talk about in science. It is how you reset the hypothalamo-enteroinsular axis. Entero component, there are 8 hormones. Let's not talk about it. And all it requires to reset this is simple diet and exercise. So I still strongly believe in the so-called lifestyle modification vis-a-vis or the non-dietary or non-pharmacological concept vis-a-vis pharmacological. And it is my personal opinion. I'm open to criticism. Pharmacology is not going to help obese people. Whatever the pharma-driven thing that has happened.
Even then, the pharmacology, we don't have much drug for the treatment of obesity, isn't it, sir? So, apart from Orlistat, there are no other major drugs available. Now we talk about GLP-1.
No, I know Dr. Aravinda spoke yesterday. I was also listening to him. So he's all, pepped up to say, no, drugs will help obese people. Okay.
Yeah, Dr. Shekhar, I also would like to ask one question.
Yes.
Before that, first of all, your picture is very clear now, at least during question and answer. So my question is that, we have so many diets, fancy diets, and everybody wants to lose weight. The moment you don't do, you fail in your losing weight, there is some amount of depression also, these people have psychologically. And especially, if we see overall percentage wise, I think yo-yo dieting is the most commonly followed by everyone, because you do something, you get some, gain, lose weight. So results are there, and then you again gain, but it gives you depression. So what I want to know is, like, something is better, as you said, yo-yo dieting. How to counsel these people, because the most important, I think, is a psychological counseling, which they have to understand, because they get, it's a vicious cycle then. Losing weight, gaining weight, depression, eating more, and again, losing weight. So ultimately they fail over time.
See, Dr. Neeta has made it very clear. Yo-yo dieting is not a prescription or a so-called component in our armamentarium. It is the effect of people's, I cannot say misbehavior, people's probably abnormal behavior. But to answer your question, there are 2 things that I would like to tell. One is, if you remember, it came from a non-medical person. I don't remember offhand the name. Diet is what we eat, and nutrition is what we should eat. So I would urge all physicians and all the so-called people who want to help these people to talk about nutrition and not diet. Yeah. I don't know how Neeta and Anjali will look at it. The second component is, once there is a food environment, it is impossible for you and me also to stop eating. So simply, KISS principle, keep it simple. The last S is for stupid, for the doctor or for the patient. Keep it simple. I continue to say the same mantra to these people: when to eat, what to eat, how much to eat. 20 times they come to me, 20 times I tell them when to eat, what to eat, how much to eat. That is good enough. I will not confuse them. See, this is my personal opinion. Please give some respect to my white beard and no hair on my head. Let's simplify the whole thing, and let's put nutrition in front of the diet. That's my opinion.
Definitely. Great.
Absolutely.
Thank you, sir.
Along with the yo-yo efforts of the patient, it is also yo-yo support from the doctor, which needs to be settled. And I think the time is up, so shall we move to the next?
Sanjay, is there anything Dr. Sanjay wants to ask Dr. Shekhar?
No, I think it was a brilliant lecture. I think we enjoyed listening to it. Thank you, Dr. Shekhar. As always, you've been brilliant in your talk.
Absolutely brilliant talk, sir. Thank you so much.
Thank you. Thank you.
Thank you, sir.
Dr. Neeta.
Bye for this opportunity. Bye.